When I started pediatric nephrology in Zurich in '69, it was in many respects a quite different world. The Vietnam War had been over, but in '69 there was the moon flight, so we thought, well, we were very optimistic that the world would change. But the reality was we had no personal computers, we had no photocopies, we had no fax. All had to be done by ordinary mail. And we had also to do the statistics manually. So one was not so productive as it is nowadays, of course. I was a fellow with René Habib in '66, and I was very fortunate. And she gave me a topic, and this was Alport syndrome, and we did the paper. It was a really very primitive compared with what is done now. Unfortunately, it was only in light microscopy and clinics and no electron microscopy, and I still feel if we had had a chance to do electron microscopy, we would have been the first ones to see the typical lesions of Alports. The textbook of René Habib and Royer and Mathieu was really crucial for me, and even more the German translation, because it was a little bit updated by Karl Scherer. He has done a very important task, and he has really introduced pediatric nephrology into Germany. We should not forget that at that time there was practically no renal replacement therapy. So if children were in hospital, they in end-stage renal failure, they would be sent home to die. And acute renal failure was anyway, well, we had some patients we could treat with acute peritoneal dialysis, but this was really rarely done. I was really fascinated that in nephrology you could measure things, you could, and that was very important. We could measure sodium, potassium, and so on, and acid base, which was rather new at that time. And I thought that this is a very good science, but we realized then with treating patients that we had to do much more in clinical work. But I think one of the big advantages in nephrology is, in pediatric nephrology, that although you are a specialist in nephrology, that you have to, the interdisciplinary work is so essential and crucial that many of us have a larger view on pediatrics than other organ specialists. I think it's not as surprising that several of my colleagues have become chairman of pediatrics, although they were trained as pediatric nephrologists. We were expecting a bright future. As I said, it was after the moon flight, but then we realized that many things, I was convinced that after a few years, renal transplantation, we would have tolerance, so we would not need immunosuppression anymore, or for hemodialysis, that the dialyzers would become much smaller and you could carry them just in a bag. And unfortunately, I must say that the machines have become even larger, so it's not exactly what I was expecting. But the interdisciplinary work, I think, apart from the pure scientific work, this is really, I think, one of the very strong things in pediatric nephrology. I think the renal replacement therapy was very important for me, because during my first training in Paris, I realized that children could not be treated, and if they were in end-stage renal failure, they would go home to die at home. When I then was in the United States, this changed within a very short period of time. And I must say, I was in a very lucky period, because when I then returned to Zurich in '69, I felt, of course, we have to do that. And I told my professor, Prader, that we need to do dialysis and renal transplantation. He said, okay. I contacted the transplant surgeon. He was very willing to do that, and with dialysis, I needed a machine, and I got one for free without any, from the very famous cardiac surgeon Senning, who was Swedish, and he got a kidney machine, a Gambro AK-10, which still at that time had a huge tank of 300 liters of water, which you had to fill and mix, and it was really. And I was the only one using this machine. It was the only one which could be used in pediatrics, because the the Travenol kidneys were, the filling volume was almost 500 milliliter of blood, so it was impossible to do it without a blood transfusion.
So at which year have you started the first dialysis in Zurich?
In 1970. Yeah. And then we had the same year we had the first renal transplant. And the surprising thing is that this patient, who was a 7-year-old with hemolytic uremic syndrome, of course at that time we didn't know about typical and atypical, but he still has his first graft functioning. It was from a deceased donor, so it was really surprising. But of course we have not been successful in all other further patients. We have realized then also with all these patients that psychosocial care is extremely important, and we started the group. My wife Christina, she was also very active as a former teacher. What was very important in my time also was antihypertensive therapy. I remember we only had beta blocking agents and another drug, I can't remember the name even, and hydralazine, so dilating. And for us, captopril was a major breakthrough, and we could really finally treat some serious children with serious hypertension in an appropriate way. What was also special at that time, we had very close cooperation with adult nephrologists, because they were also at the beginning with renal replacement therapy. And for me, the contacts were very, very important. By the way, during the first few years until about 72, 73, we had more transplanted children in Zurich than in Paris. But of course it has meanwhile totally changed.
This has maybe tell a little bit about your Armenian
that was and at the end of December 88, I was asked by the Swiss Society of Nephrology whether I'd be willing to go to Armenia for acute renal failure patients after the big earthquake in Leninakan. At that time there were about 25,000 victims died, and many had crash syndrome. And I could arrange myself, I must say, it was thanks to my chief, Andreas Fanconi. He agreed that I could take a short leave, we would not know for how much. And when coming there, I was totally shocked, because we all thought, well, they had the Sputnik, they had the first man in the air, but the reality in hospitals was really so miserable. It was a good exercise for me to do acute dialysis. We could sometimes not even measure the potassium or hemoglobin, and you had just with feeling and everything. This is maybe my generation is still used to work under very primitive conditions. But then we started a program which is now an official one with the University Children's Hospital in Zurich, with the Children's Hospital Arab-Care in Yerevan, and we have exchange in both directions, and it works well. And I never thought that after my retirement, which was in 2000, that 17 years later I would still be busy in this business. But it is really fascinating. But it is not only in nephrology; it is many other fields, and I have very good colleagues.
And maybe a few words for the future. What would you like to wish the next generations of pediatric nephrologists?
Well, what I wish perhaps first it would be that there would be less administration. I see it already in my last active years. I realized that administration is becoming more and more, and I think I would not survive if I had to do it as it is now, but maybe there is a hope that it will improve. I think also we should have, or I hope that the future people have more time, more freedom, not to restrict. We have in Switzerland now the situation that residents are not allowed to work more than 50 hours a week, and sometimes there is more work, sometimes there is less work, and they're not allowed to be flexible in this respect. Something we could not imagine that anyone would tell us to work less. Yeah. I think the interdisciplinary work is crucial for pediatric nephrology. I was always interested in lab results, and I think it would be very important for clinicians to go also in the lab and discuss it, and just to see another way of work. And of course, this has to do with Armenia. I think it's really a chance to work in a country with limited resources. It could also be in Africa, where I had also been. I think it's a unique chance, and but I think it's more worthwhile when you have already had your training, not at the very early in the beginning. And of course, now you are from Eastern Europe, Elena, and you know how important it is to have contacts with and training with people in these countries. And I think we should encourage, and I think for a young generation it would be so good also to go to these places. Thank you.
Thank you.